Looks like we could go for another IV bag here. Oh, hi. How are you feeling? Oh, it's okay. You don't have to. You don't have to speak. My name's Yvette. I'm the night nurse here in ICU. It's okay. You were intubated. Your vocal cords and your throat might be very, very sore, so don't feel obligated to try to speak at any point, okay? Unless you're comfortable. You arrived here, a Good Samaritan had brought you in, and you were struggling with some of the common questions that we typically ask when someone's disoriented. So I don't want to be the one to, give a diagnosis or anything. I'm just here to kind of review your charts, make sure that your medications and your IV bag and everything is taken care of. Okay. Oh, I can definitely put a request for the morning shift. The doctor will come in and give you a briefing now that you're awake. All right. Well, for now, I'm just going to take care of you and make sure that you stay as comfortable as I can make you and kind of go from there, all right? Okay. Well, I have no expectations, so whatever is most comfortable for you, just let me know if there's anything I can assist with, okay? All right. So we've got a new IV bag here, so you should be good for a little while as far as hydration and nutrients go. And on your chart, it shows, it's going to probably be another day or two before we try different swallowing tests and stuff, okay? Okay. Well, again, those aren't really my decisions. I'm just going over some of the notes on here. Okay. Yeah, your vision's blurry. Do you mind if I put my hand on your forehead a little bit here just to see if you're warm, anything like that? Okay. If you need anything, just try to let me know, okay? Are you comfortable? Do you want me to help adjust, pillow repositioning, anything like that? Do you feel pressure in any area? A little too much? Oh, of course, yeah. Of course. So do you want to sit up a little bit? Okay. And is that a little bit better? Okay. Let me just move the pillow here behind you a little bit. Give you a little bit better posture on this side. Okay. How's that feel? Okay. A little bit better? All right. Okay. Just let me know if I can help anymore, okay? All right. I'm just gonna adjust the cannula in your nose here. This is for your oxygen. Okay. Yeah, we just want to make sure that it's placed there nicely. Do you feel any shortness of breath, anything like that? No? Okay, that's good. That's good. Let me tuck it in behind your ear just a little bit. I'll make it a little tighter so it doesn't fall out there. You okay? Okay. All right. Okay, so it does look like we got you on a little bit of oxygen here, and just checking on you probably noticed a little bit of pressure on your index finger here. We've got an oxygen meter on it, and you're about 98 to 100%, so you're doing pretty good. Okay. Okay. Is your vision blurry? Mm-hmm. I'm sorry. Yeah. With your permission, I'm just going to check some of your vitals. And maybe some of your reflexes to make sure that if you have anything alarming, I can report it to the doctor on staff. All right? Well, the first one might be a little bit difficult, especially with your vision being blurry, but I'm just going to test your ocular reflexes. Okay. Thank you. And please let me know if this is uncomfortable, okay? Okay. All right. Is it okay if I just lift up on your eyelid a little bit? All right, thank you. Okay. Yeah. You have a little bit of a delay in the constriction, but that can be for a number of reasons. Okay. I'm going to pull down on your eyelid. Is that okay? Thank you. Alrighty. So this is going to come in from the side. I know that your vision is very blurry right now, but just let me know when you can see the light come into your peripheral. Okay. And how about from the other side? Okay. Well, that's good. Okay. Do you have any idea what time you might have come in here? Do you remember any of the events leading up to your admission here? What's the last thing you remember? You don't have to talk too much, it's okay. Okay. Do you know what today's date is? How about the year? Do you know what your first and last name are? And your birthday? All right. Yeah, it's okay. There's not a pass or fail to those questions. It's just to kind of gauge, the severity of, what you might have gone through. Yeah, but we're here to help, so it's not like a pass or fail. It's never a pass or fail. Okay. Well, if it's okay, I'm gonna just continue what my normal check-in was supposed to be, which is your vitals, checking your heart, your blood pressure, your breathing, checking your skin to see if there's any irritations or lacerations, anything like that we need to be aware of and cautious with. I'll try my best to be gentle. All right. So I'm just gonna start with your chest. Is this okay? All right. Do you want to lean back a little more? Of course. Yeah. Good. Just gonna tilt your pillow a little. Is that okay? No? Okay. Just prop you up a little bit right there. How's that? Good? All right. Let me know if that changes. Okay. Just going to take a listen to your lungs. And just try to breathe normally for me right now. You don't have to stress about it, okay? Mm-hmm. Do you mind giving me just a little bit of a... Okay. And again? Okay. Right, I'm going to lift your left arm just a little bit here. Okay. You don't have to worry about bearing any of the weight for it. I'm going to go ahead and coordinate all of that for you. Okay, so just relax. I want to listen to the ventricles on your left side here. So I'm just going to lift up your arm. Does any of this hurt at all? Discomfort, anything? You all right? Okay. Let me know if that changes. I'm going to scooch here into your back. Is that okay? All right, I'm just going to turn you a little bit. Just a little bit. Okay. And then we'll listen to the back side of your lungs. You're right. I gotcha. Okay, a little further down. And I might scoot around to the other side. Is that all right? Okay, just try to reposition you very gently. Okay. Do the same over here. Okay. Does any of these areas, do they hurt at all? Anything like that? Okay. And just a little further down. Okay. All right. Gonna listen to your belly. You okay? Okay. All right. Just listen to your tummy here for a bit. Now I'm going to do something that might be a little bit uncomfortable. I'm going to just push in with my fingertips lightly on your tummy. Okay? And I'm going to listen at the same time. And let me know if you have any discomfort, okay? Okay. And on the other side. Okay. Well, you sound good. Your heart sounds nice and strong. Your lungs sound clear. Your digestion sounds normal. So that is always good news to give. I'm going to document that on my tablet here, and that'll be for the other nurses and the doctor. So I'm going to check your IV. And you got one on your wrist here. Okay, does this bother you here? Does, like, if I touch around this area, does your skin feel irritated, anything like that? Okay. And it's warm to the touch, but that's normalish. Okay, it looks clean. It's nice and sealed, so that's good. All right, I'm just gonna look around your face and your eyes just to see if there's any abrasions, any other wounds that are making themselves evident since your initial admission. All right, that's gonna require me to get a little close. Is that all right with you? Okay. And if that changes, let me know. Okay. Do any of these areas of your head feel uncomfortable? Okay. Kind of like if, you were to press on a bruise or anything like that. Do you feel anything like that? Okay. Just gonna check the top of your scalp a little more. Yeah, we'll make sure that we get, your hair combed and get you more comfortable. Right now we're just making sure you're okay. And I'm going to do a little bit of manipulation on your face here with your permission. I'm going to pull up on your eyebrows. I want you to try to resist me. Close your eyes. Okay, good job. And again. I'm going to do the same thing but on your bottom. Okay. Can you puff out your cheeks for me? I'm going to go ahead and try to squeeze them. Don't let me do that. Okay, very good. Do you have any sense of smell? Let me get a swab of isopropyl alcohol. Do you smell this? Okay, good. Good. It's always good. And hearing is seemingly okay? What if I pinch on your ears like this? Do you feel any kind of discomfort? Okay. On the side? Okay. Just gonna look into your ears real quick to see if there's any kind of discharge, anything like that, okay? And I might pull on your ear a little bit more on this side. Okay. And if I pull up on the ear like this, is this okay? Other side. Okay, good job. Good. And look into your eyes real close. Is that all right? Okay, this might require me to get really close. All right. Looks good. Do you feel hot, cold? Is there anything that would be more comfortable for you? A blanket, turn the air up, things like that? You're all right? Okay. I'm going to test some of your eye coordination. So if you wouldn't mind trying to follow my finger. Okay. It's okay. I know that might not feel very good. I'm going to do the same with the light. Okay. And this is going to come close. Follow? Okay. That away. Okay. Not too bad. Okay. And can you move your arms or your limbs at all? Okay. All right. What I'm going to do then is I'm going to hold your hands, both hands at the same time. I want you to give me as much of a squeeze as you can, okay? Go ahead and squeeze. Okay. I'm going to pull you forward. I want you to pull back, okay? Resist me a little. Okay. Okay. Oh, don't worry about it. It's okay. It's okay. We're making progress. We're just gauging where you're at right now. You just woke up. You should see me when I just wake up. I'm never active. You're fine. You're fine. It's okay. You're fine. We'll figure this out. Okay. Leading up to any of these events, do you have any recollection whatsoever if it was an event? Were there any other influences? Alcohol? Any other substances that you can think of? Oh, I'm not going to judge. This is a judge-free zone. Just trying to figure out how to best take care of you. Okay. And at that event, can you think about what led up to feeling that way? Okay. And how long would you normally suspect those types of events go for you? Have you ever had them before? Mm-hmm. How about any kind of, let's think about long-term memory. Think of a memory from childhood. Can you give me any examples like that? Just describe to me an event that you can remember from childhood. Or a person that was in your life at that time. Okay. Maybe a couple of years forward, do you remember something a little bit more recent? Okay. And for things in the short term, do you remember the last bad weather event that we've had? Okay, it was a couple of days ago. You do? Good. Good. Okay. So short-term memories, good. Okay. So it looks like in the schedule for the next couple of days is we're going to be doing or scheduling a post-intubation swallow test. And what this is going to entail is watching under a radiograph. So a radiograph is going to basically be a real-time x-ray, and we're going to be looking at your throat and your trachea as you swallow liquids of various viscosity, okay, thickness, just to see how well you can swallow. Okay. Alrighty. I'm going to check your hands and your feet here just to see if there's any kind of circulation or ulceration, anything like that. Is that all right? All right. I'll start with your hands. And I'm just going to squeeze your fingertips a little bit here and then watch the color come back. Okay, on each finger and flip them over. Okay, and how about your other side? Circulation looks good. I'm going to move down to your feet here, so just give me a second. All right, I'm going to check your feet. And the other one here. Do you feel any kind of discomfort in these areas, like when I'm depressing here? Okay. And your heels look good. All right. Your feet look pretty good, so that's a good indicator. And we'll just keep an eye on those though. Okay. Alright, last but not least, I'm going to check the telemetry nodes on your chest here. Okay. Okay. If I get really close to you and just kind of examine these nodes, the sticky pads on your chest, is that okay? Alright, thank you. So you're usually going to watch your heart rate, things like that. And everything on the monitor looks like it's coming back accurate, and we don't have any loose connections. You don't have any major skin irritations or anything like that going on, so no, it looks good. It looks very good. Okay. And are these wires bothering you at all? Okay. Alright, well. So that's good. Your O2 saturation looks good. Your circulation looks good. You don't have any loose connections. All your readings are coming back nice and strong, so that's always very good. Alright. Well, I'm going to go ahead and add this to your chart, and the morning nurse will be back in shortly. Hopefully she'll be comforting and be able to take care of you. Is there anything else I can get you before I go? No? Alright. You just want to sleep? I know. Quick note, there is a bed alarm that will go off if you get up, so if you need anything, ring the bell here on the side here. Yeah, because if you get out of the bed, it's going to set off an alarm. Alright. Well, then maybe just try to take this time to relax. You're in good hands. Okay, take care, sweetie. I'll be back to see you soon.